everyone, welcome back to our Fire Nursing tutorial YouTube channel. In this class, we are going to discuss with important MCQs. Who all have visited first time on this channel, please do subscribe. To start with the first question. Single umbilical artery not associated with. Options are here. Esophageal atresia. Next question. Anaphylaxis is example of. Distributive shock. Next question. When examining a patient who is paralyzed below the T4 level, the nurse expects to find. Options are here. That option is D, that is independent use of the upper extremities and efficient cuff. Next question. Which of the following is an appropriate nursing intervention for a patient with dementia who develops a catastrophic reaction? Options are here. Right option is C, that is eliminate or reduce environmental stimulation. Next question. The nurse performing MSc and patient continuously saying without any context that I want to go home. So what can be interpreted? Options are here. Right option is B, that is verbigeration. Next question. A mini mental score is 19. Indicate. Right option is B, that is cognitive impairment mild. Next question. Which is the weekly use contraceptive pill? Right option is A, that is Saheli. Next question. What is the priority nursing assessment in the first 24 hours after admission of the client with a thrombotic stroke? Right option is B, that is pupil size and pupillary response. Next question. The normal duration of human pregnancy is? – 40 weeks. The hormone responsible for milk ejection is? Right option is oxytocin. The ideal pelvis for normal vaginal delivery is? Gynecoid pelvis. The first fetal movement felt by the mother is called? Quickening. The normal fetal heart rate is? 110 to 160 beats per minute. Which vitamin prevents neural tube defects in fetus? Right option is C, that is folic acid. The best position during cord prolapse is? Knee chest. Which hormone maintains pregnancy in early weeks? Hormone HCG, human chorionic gonadotrophin. The normal site of fertilization is? Fallopian tube. The first stage of labor ends with? Full cervical dilatation. The average blood loss in vaginal delivery is? – 500 ml. Preeclampsia is characterized by? Hypertension, proteinuria and edema. In pregnancy, the earliest sign is? Amenorrhea. Oxytocin is secreted from? Right option is B, that is posterior pituitary. The normal amount of amniotic fluid at term is? Right option is C, that is 800 ml. The length of umbilical cord is approximately. Right option is C, that is 50 centimeter. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.